So hello friends, now in this particular video we are going to start with the discussion of Nsaid, the next part of our Autocoid pharmacology series. So coming to the first point, that is what is the mechanism of action of Autocoids. Okay, so Autocoids basically inhibits one enzyme that is known as COX. Sorry, Nsaid basically inhibits the enzyme COX, and by inhibition of COX there will be no formation of prostaglandin and thromboxane A2. Clear? And from the pathology you are knowing that COX is of two type, COX1, COX2. Okay, it has housekeeping functions, and where COX2 is inducible type. Clear? But it has constitutive enzyme action in kidney, endothelium, brain and fetus. Now coming to the drugs, that is the most important part. So first drug is irreversible non-selective COX inhibitor, that is your aspirin. This is irreversible and non-selective COX inhibitor. Second is your reversible COX inhibitor. So it includes non-selective COX inhibitor, preferential COX-2 inhibitor and selective COX-2 inhibitor. Three groups under reversible COX-2 inhibitor. COX inhibitor. So reversible COX inhibitor include three groups: non-selective COX inhibitor, preferential COX-2 inhibitor, then selective COX-2 inhibitor. And the third group is your analgesic-antipyretic, which has poor anti-inflammatory effect. Okay, these two groups have good anti-inflammatory effect, but this group has poor anti-inflammatory effect. Now, what are the uses of NSAID? So first, it is used as analgesic. Okay, then second as antipyretic, anti-inflammatory. It also helps in closure of patent ductus arteriosus, which is a congenital heart disease. Clear? And drug of choice for this ibuprofen, indomethacin or aspirin. Now moving to the next part. Fifth use as a tocolytic, okay, for delaying the labor or increasing okay. The sixth use as antiplatelet drug. So it can be given in MI, stroke or peripheral vascular, and here only aspirin is used for these cases such as MI or stroke like this. Now what are the common side effects which are associated with your NSAID? So most common side effect is nausea and vomiting. Remember this, most common side effect associated with NSAID is your nausea and vomiting. Second common side effect is peptic ulcer. Okay, because by inhibiting these enzymes there will be decreased prostaglandin synthesis, there will be decreased bicarbonate, and there will be decrease the basically there will be decrement in protective functions of the mucosal membrane. Okay, now the third is your nephrotoxic. NSAIDs are basically nephrotoxic in nature. And the fourth, it may elicit your allergic reactions such as rashes, SJS, asthma or angioedema. One triad is important here, that is SAMPRA triad. Okay, aspirin plus asthma plus ethmoidal polyps in the nose. It occurs due to increased LOX activity because COX enzyme is inactivated, so the pathway is turning towards the LOX. So LOX pathway will be more activated because COX pathway is inhibited. So that will lead to this SAMPRA triad: aspirin plus asthma plus ethmoidal polyps in the nose. And the treatment is leukotriene receptor blocker, such as montelukast we can give. Now one more point, you are knowing that prostaglandin dilate afferent arterioles in the glomerulus, and NSAID by decreasing prostaglandin, so it will decrease blood supply to kidney. Now the tip of loop of Henle, which is known as papillae, has least blood supply, so the cells will start dying. So first the cells will start dying in papilla, so this will lead to papillary necrosis. Clear? And it is also known as analgesic nephropathy. And one drug, that is phenactizid, it was banned due to this papillary necrosis. Okay, phenactizid was banned due to papillary necrosis. So this is the basic idea about the side effect. Fifth, it can delay labor. Sixth, it will increase bleeding time. So these are the common side effects which are associated with NSAID. So once again revising, the most common side effect is your nausea and vomiting. Then peptic ulcer is there. Then it is also nephrotoxic in nature, that is leading to papillary necrosis. It is also responsible for causing allergic reactions. It is also responsible for delaying labor, increasing bleeding time. Now coming to the first drug, that is aspirin. So aspirin is non-selective irreversible COX inhibitor. So it will inhibit COX-1 and COX-2 both, and route of administration is oral. And it is an example of hit and run drug, and it also causes suicide inhibition. Now what are the uses? So in low dose, means milligram, so 40 to 33 to 5 milligram per day, you can give this in the patient of MI. In MI patient, we use this dose 40 to 325 mg per day. We give first in loading dose, that is 325 mg Okay, then we can go for the maintenance dose. And at this dose, that basically in mg, it is basically antiplatelet in nature only. Okay, and in higher doses it will show its antipyretic, analgesic and anti-inflammatory effect. For anti-inflammatory effect, at least 2 to 5 gram of dose is required, and less than 2 gram, at less than 2 gram dose it will show antipyretic and analgesic effect. Now it will be drug of choice for MI, stroke and Burgers disease. It is also drug of choice for Kawasaki disease and rheumatic fever. Clear? So this is aspirin is a drug of choice for Kawasaki disease or rheumatic fever, like this. Now, what are the miscellaneous uses of the aspirin? So it can be used in case of Alzheimer's disease, familial adenomatous polyposis, and it is also used in ACE inhibitor induced cough. We are knowing that ACE inhibitor has a side effect, that is cough, because of the increased amount of bradykinin. Okay, because of the increased amount of bradykinin, it leads to the cough. So for controlling that ACE inhibitor induced cough, we can give aspirin. Now, what are the precautions we should take while taking aspirin? So hypoglycemia in diabetic mellitus patient can happen. Then aspirin associated with viral fever in children. Okay, it may lead to hepatic encephalopathy, which is known as Ray's syndrome. So if the aspirin is administered to children who is suffering from viral fever, then it may lead to Ray's syndrome, that is hepatic encephalopathy. So it is avoided in children. As an antipyretic, we give paracetamol. Now the second, it also interfere with uric acid. So in less than 2 gram dose, it increases uric acid in blood. In 2 to 5 gram dose, unpredictable effect, and more than 5 gram, then it will decrease uric acid in blood, because it has uricosuric action. It will increase excretion of the uric acid. Getting a point? Now coming to the aspirin poisoning, which is also known as salicylism. So it is most commonly seen in children, and fatal dose is 10 grams to 30 grams. This is the fatal dose for the aspirin. And what are the clinical feature when a patient is suffering from aspirin poisoning? So vomiting and diarrhea will be there, and that vomiting will lead to dehydration, and this dehydration is the main cause of death. And for the treatment of this, we will start IV fluid. The second feature, you will get acidosis, then hyperthermia will be there, then tinnitus, hypoglycemia and bleeding will be there. And what are the treatments? So treatment is just sodium bicarbonate, and if very serious, then we have to do hemodialysis. Now for hypoglycemia, we can administer dextrose. Okay, now moving to the next part, that is reversible COX inhibitor. So coming to the first group, that is non-selective COX inhibitor. Okay, reversible non-selective COX inhibitor. So first drug is indomethacin. It is used for arthritis. It also causes PDA, that is patent ductus arteriosus. Okay, and it is also given in preterm neonates to decrease the risk of hypoxic ischemia encephalopathy. Now most side effect. So most common side effect is frontal headache. So indomethacin, most common side effect is frontal headache. It may lead to seizure and sedation. So because of seizure, it is contraindicated in epilepsy, and because of sedation, it is contraindicated in pilot and drivers. Getting a point? And this Sulindac is prodrug, and its active form is basically indomethacin. And the next drug is ibuprofen. So it is safest NSAID in children. Getting a point? And one side effect, that is aseptic meningitis, is there. And the drug of choice for dental pain or patent ductus arteriosus, ibuprofen will be the drug of choice. Then floriprofen and ketoprofen, they both are used as eye drop or nasal drop in case of conjunctivitis and rhinitis. Then there will be naproxen. It is second most cardio safer drug. Okay, first is aspirin, and after aspirin, naproxen. Then nembutal, the only basic NSAID. So there is the MCQ question. Okay, only basic NSAID, like this. Then phenylbutazone, it is banned. Now the next drugs are mefenamic acid. It is drug of choice in dysmenorrhea, that is menstrual pain. During menstrual pain, drug of choice will be mefenamic acid. Then piroxicum, tenoxicum, they are longest acting NSAID. And ketorolac, it is given through IV route, and it is used for postoperative analgesia. So these are the non-selective COX inhibitor. Then coming to the preferential COX-2 inhibitor. So it includes nimesulide, meloxicam, eclofenac, diclofenac and etodolac. Okay, NMADE, NMAID. NSAID, nimesulide, meloxicam, then aclofenac, diclofenac, and etodolac. Now moving to the next part, that is selective COX-2 inhibitor. So you can remember the name as, because inhibitor, so I will come, inhibitor means this sign will come, okay, and COX-2, so B will come, 2 for B, so remember it like this, XIB. So it includes drugs such as etoricoxib, paracoxib, celecoxib, lumiracoxib, and the most important advantage associated with these drugs are that there will be no risk of peptic ulcer if we give this particular drug, that is selective COX-2 inhibitor, because it do not inhibit COX-1. Now what are the disadvantages? So MI, stroke. So two drugs are banned for this, rofecoxib and valdecoxib. Getting your point? Because these drugs increases the risk of thrombosis. Now lumiracoxib, longest acting, and it is the most selective drug, and the side effect is liver toxic, so it is also banned. Etoricoxib and paracoxib are available. Celecoxib is also banned due to MI and stroke. Now coming to the last group, that is analgesic-antipyretic, means those drugs which have poor anti-inflammatory effect because there is no action on COX-2. Okay, these drugs have no action on COX-2, so they have poor anti-inflammatory effect. So what are the drugs? So first is your paracetamol, then metamizole, then phenacetin, then nefopam. Now this paracetamol also inhibits COX-3 enzyme. Get your point? Now this phenacetin is banned. This phenacetin is banned due to papillary necrosis. Now coming to the paracetamol, which is the most widely used drug. It is most commonly used drug worldwide, and it is under the over-the-counter drug. Maximum daily dose must be less than 4 grams per day, and side effect, or we say poisoning, the clinical feature is same that we have discussed in aspirin. It is also hepatotoxic. Basically it causes centrilobular necrosis. This is very important one. It causes centrilobular necrosis with periportal aspirin, because maximum CYP enzyme are located around the center of lobules, and that is the basic reason that it is leading to periportal aspirin, or basically centrilobular necrosis. Okay, basically it causes necrosis around the lobules because of the presence of CYP enzyme. Okay, it spares the periportal region, and this is hepatotoxic due to this increased amount of NAPQ1. Now what are the mechanism of action? So paracetamol, after metabolizing by enzyme CYP to E1, it converts into NAPQI, and after phase 2 normal dose gluconide conjugation occurs, and in toxic dose glutathione conjugation occurs, and risk of toxicity increases when the person is taking alcohol, because it induces CYP to E1 and it also depletes your glutathione, or if person is taking isoniazid, because isoniazid will induce CYP to E1. So these are the two risk factors for the toxicity of paracetamol, that is alcohol and isoniazid. What are the treatments? So drug of choice will be N-acetylcysteine, or you can also give methionine, because it will replenish glutathione concentration. Supportive treatment is just like aspirin poisoning. So this is about paracetamol. Clear? So this is about your all Nsaid, and we have covered Autocoids. Okay, so thank you for watching. If you like the video, please subscribe us and support us. Thank you.